Good morning, baby Eloise. Good morning. She's getting so big already. So today we're headed up to Columbia. It's the day of the CT scan. Rachel's getting ready. Eloise is about ready for nap time. So we're gonna drive up during nap time. Just a heck of a lot easier. Gorgeous day out there today. We're at Rachel's parents' house, our old house.
Ready to do this? And by do this, I mean nap in the car for an hour and a half, the whole entirety of the hour and a half drive to Columbia. All right.
She's crying because she has to get the IV. So it is a CT scan with contrast, which I figured it would be.
She's not crying right now because she's getting an IV, just because she knows that she has to now.
Well, that stinks. So we got her down and all ready to go on the CT table. But turns out they have to wait a half an hour after they do the dye. And she was asleep and everything, so now we need to decide if we want to keep her asleep or if we should wake her up and try to get her back to sleep in a half hour.
She's gonna be just waking up right when they need to do the scan.
She did great with the IV though.
Did she?
Yes, she did. So we finished with the CT scan.
Could have been worse.
Oh yeah, could have been worse. Could have been better. Could have been worse.
Definitely could have been better.
The timing was awkward.
Oh, it was just like the worst timing. Like she woke up right as I set her down for the CT scan, which I guess it wasn't where she was tired enough right before a nap that she was really losing her mind, but she still didn't love it. But then we had to wait 10 more minutes and do another one.
Of the bladder.
Yeah.
The first one they did of the kidney and then of the bladder.
Right. So we had to do 2 of them 10 minutes apart, which was fine.
And she just did great for the ultrasound, so next we'll head to go see the doctor.
It's always awkward though, like she's falling into somewhat of a schedule. Oh, she's happy now. Somewhat of a schedule where she just has more predictable nap times, and being away from the house for an entire day like this just puts a lot of pressure on me to get her to take a decent nap in my arms, which is like all day long adds up, you know. It's like, it's a lot easier to be able to at some point put them down for a nap than to like hold them the entire time. And it's always awkward like feeding her too. It's just not, I'm not like in my comfortable nursing chair. I'm in like a hospital waiting room chair, so it's just awkward, and she doesn't eat that well, and I don't know. I'm like trying to stay covered up and not offend everybody. So days like this are hard when we're just away from home all day. I know, I don't like it.
Well, I think every parent can relate to this one. What was the initials?
WFPDC.
Wet fart post diaper change. Just changed Eloise's diaper. not more than 2 minutes later.
It smells like buttered popcorn in here.
Yes, it does.
Let us know if you have a breastfed baby, does their poop smell like buttered popcorn? Because it smells like a movie theater in here now. The key to not having a double WFPDC is waiting a couple minutes for the aftershock. You want to make sure they're totally done so you're not rapid fire changing a diaper again.
Time to breastfeed. We are done meeting with the specialist, and now we're gonna get ice cream.
We deserve it.
Eloise deserves it. She'll get it through your milk.
Yeah, totally.
Turn the page. Okay. Who's wearing a blue helmet? Who's got a blue helmet? Good job, Bear. Yeah, blue hat. Is that person wearing glasses? Yes. Awesome. Which hen gave birth to polka dots? Polka dots? Polka dots. What? Is it giving birth?
Laying an egg.
Laying. Good job.
I guess it's giving birth.
Can you count how many eggs are here?
1, 2, 3, 4, 5.
Yep, there's one. How many are right here? Just right here, how many?
2, 3, 4, 5, 7.
Oh, how about just 1,
Daddy,
2,
we could be
3.
Daddy.
Oh, are you done with this? You don't want to play anymore? Well, who has a tennis racket? Good job.
That's
Wow,
it's
great
right,
job.
Lyndall. Looking good in here. I have Eloise set up in her little corner with her butterfly. Eloise, you had a big day.
Huge day.
She did good.
She did really well. Timing could have been better for the CT scan, but
I know.
what are you gonna do?
It could have been worse.
That's for darn sure.
I'm emotionally drained.
I was gonna say, I bet you're just like a ball of emotions.
I'm just really drained. I'm tired.
I believe it.
Are you tired?
Yeah,
Do you feel drained?
yeah. Ice cream helped.
It did help. That was a nice little boost.
Except for the problem is, now it's like our dinner.
Dinner, I know.
I mean,
that
it's
was our dinner.
8:45 p.m.
We can't eat dinner now.
First world problems.
I know. We had ice cream too late in the day.
What are you gonna do? Anyway.
I guess it's a good thing that it
Enough
replaced
about
our dinner.
ice cream.
Right.
So what's the next step from here?
The next step from here would be surgery or monitoring every 3 months.
Yeah, that just sounds miserable.
We'd have to go to Columbia every 3 months and at least have an ultrasound. I don't know how often they would repeat some of the other testing, but 2 of the other tests she needs an IV for, so I'm not excited about like repeating those.
So our doctor brought up the point that, so surgery would be to correct.
The hydronephrosis.
Exactly. Which at the, what was that test, VCUG?
Uh-huh.
At the VCUG, we discovered that Eloise has function of the kidney that's super dilated.
That wasn't the test that determined that. That was the test that determined she did not have reflux. I
Well-
don't know the name of the other test.
Which one was the one that proved that she had 33% function?
Some other name of some other test.
The X-ray?
The interesting thing is though, the dye IV, watch how the kidneys function test, where she had to lay there still for 45 minutes.
Was the VCUG the X-ray?
The VCUG was,
For some reason, I thought that was the nuclear medicine
I
test.
feel like I consider both of them X-rays.
Well, the nuclear medicine test, I don't
They
think.
both use dye though. One of them used dye via catheter and flushed it into her bladder to see if it went up into her kidneys. And the other one they ran through her blood and tested the function of the kidneys.
Yeah. What was the name of that one?
I don't remember.
Whatever the name of that. We could look on our Bridge app.
And yeah, we'll be able to figure it out then.
But anyway.
So what was interesting though, and what I gathered from today, is the CT scan showed that the north pole, the superior pole of the kidney was functioning at 33%, before it was perfect. So it's already lost function. And she said anything below 40%, she recommends intervention. The other big factor on whether or not we would do surgery is because we didn't know where that extra ureter went, the ectopic ureter. We didn't know where it inserted, and it was possible it inserted somewhere where she would not have control of her urine. And we did determine today that it inserts into the lower portion of the bladder above the sphincter.
This is way better anyway.
It is.
Yes, above the sphincter. However, it's sounded like she thinks that it only drains when the sphincter's open.
Correct. So that might be why it's so dilated.
Right.
She said that the ectopic ureter was like a giant sausage.
Yeah.
Like it's huge.
Yeah, it is big.
Like you could see it on there. It looks like an intestine.
They could probably see it from the moon.
Probably. That was a weird joke.
I know.
You could see Eloise's ectopic ureter from the moon.
Anyway.
Hey, that was a good mood lightener.
Yeah, exactly. You're welcome.
Thanks.
So, she didn't give us a timeline about when we need to decide what we're going to do next. I think we know that we're leaning towards surgery.
I think Heath knows for sure. I'm still on the fence. And it's because she keeps giving us the option that it's... So, and I'm kind of on the fence because she keeps presenting it to us like it's our decision. So it just makes me like want to make a really informed, well thought out, well prayed about decision.
But she also did say if it was her, she has a almost 3-year-old daughter. She said if it was her daughter, she would do the surgery.
Right, and that definitely had a big weight on me. But also not one of the main reasons, but I felt like what held weight in the fact that I would have wanted to do the surgery was because it wasn't fair for me to decide that she could potentially be incontinent. Is that the right word?
Yeah.
Incontinent. So now that I know that that may not be an issue, I don't know, it just makes it really difficult. It's just a very difficult decision, and I'm fully aware that there are worse conditions out there, and we have a really ideal situation where we have a correctable condition. Although she said a third of the time it gets better, a third of the time it stays the same, and a third of the time it continues to deteriorate once they do the procedure.
Yeah,
so
even after they do the procedure.
We may do the surgery and there be no saving that portion of the kidney. But anyway, I'm gonna stand up with her.
Yep. So we appreciate everybody who has emailed us. If we haven't emailed you back, thank you for emailing us with your stories. We really appreciate it. It's awesome. And we'll keep you updated.